I see there are still a few folks joining us, but it is a couple of minutes after the hour, so I'd like to get started. Can you hear me, Kathleen?
I can. You're a little echoey, but I think it will be okay.
All right. So let's get started then. We won't bother with a roll call because folks can see the names of most of the people who are joining on the screen, assuming you've connected up to us with through the webinar Adobe Connect. My pleasure to welcome everybody to our Academic Health Department Learning Community meeting today, the first of the new year. We're delighted to have so many of you with us. Because we are today featuring Jessica Kronstadt from the Public Health Accreditation Board. Jessica is the Director of Research and Evaluation and will be discussing public health accreditation with some attention being paid to its relevance to academic connections for health departments. But first, Kathleen, you want to start us off?
Yes. Thank you. We just wanted to run through a couple of housekeeping items before we get started. So first, you'll have noticed when you logged in that you had a couple options in terms of listening to the audio. So either using your computer, microphone, and speakers, or dialing in over the phone. Regardless of which option you picked, we ask that you please mute your phone or your microphone when you're not speaking so that we can eliminate as much background noise as possible. Also, if you have chosen to dial in over the phone, you'll want to be sure that your computer speakers are mute so that you don't get an echo as you listen to the presentation today. You'll see in the top right-hand corner of your screen, we've put the links for both the presentation slides and the brief one-pager about accreditation that we shared prior to the meeting. So if you're interested in downloading either of those, you can find them there. As you probably heard when you logged in, we are recording the meeting today so that we'll be able to provide you all and everyone else in the learning community with an archived version after the fact. And finally, we do encourage questions along the way in the form of chat comments. So if you have questions or comments at any point during Jessica's presentation today, please feel free to type them in the chat box. We will be keeping track of those, and we'll make sure to bring them up when we have a discussion portion at the end. Once Jessica's presentation is finished, we will also, or you will also be able to unmute your phone and ask a question verbally as well if you prefer. So again, please put everything on mute, and we hope you enjoy the presentation. Thank you.
Well, thank you so much for having me. I am delighted to be speaking with you today. This, I think, is, and I hope you'll agree by the end of the day, if you don't feel this way already, there are many opportunities for health departments and academia to collaborate for accreditation. So today I'm going to begin with a really brief overview of the PHAB accreditation program and then share with you some of my ideas about what that collaboration might look like. But I hope we'll round out the discussion with really a lively conversation and hear from you all about suggestions or ideas about what those collaborations might look like. As promised, I will just start by giving a little bit of an overview of PHAB, or the Public Health Accreditation Board. I see that there are many representatives from accredited health departments or health departments that are going through the process now and their partners. And I also see that there are some site visitors who are joining in the call. So I apologize for those of you who are already PHAB experts, but I did want to just provide a little basic information so that we could all be on the same page. So I wanted to start by the goal of PHAB and really emphasize that the reason we are here is because we hope to advance the quality and performance of tribal, state, local, and territorial health departments. And the way we do that is through the accreditation program. Accreditation is the measurement of health department performance against a set of nationally recognized, practice-focused, and evidence-based standards. And I'll come back to that phrase, practice-focused and evidence-based standards, in a moment. And then the issuance of recognition of achievement of accreditation within a specified time frame by a nationally recognized entity, as well as the continual development, revision, and distribution of public health standards. So we'll be talking more about these components throughout. It is important to note that this is a national accreditation program, but it is voluntary, and that we really hope that the reason health departments decide to pursue accreditation is because they see the opportunity to engage in quality improvement throughout the process. So now that I've told you why we exist and what we do, just a couple of sentences about who we are. We are a nonprofit organization. We're located in Alexandria, Virginia, right outside of Washington, D.C. We were formed in 2007, and then there was a very extensive program of developing accreditation, so working with the field to develop appropriate standards and measures, as well as what the accreditation process would look like. And so that took over 4 years, and it really did involve hundreds, if not thousands, of public health practitioners, as well as representatives from academia and others, to make sure that this was an appropriate program. We launched in September 2011, and we've come a long way since then. This slide here shows you where we stand in terms of accreditation activity, and it's actually a little bit out of date, so I'll give you even newer numbers. But since our launch in 2011, there are now 60 accredited health departments, and then there are an additional 250 health departments that are in the system but have not yet become accredited. So going from 0 to over 300 in a short period of time is something that we're really proud of. The other thing that I think is impressive is that there's really great geographic spread. So on this map, the states that are colored in green already have an accredited health department, and the ones in blue have at least one health department that's going through the process. And where we currently stand now, we have at least one health department in the process in all but 6 states. So we're excited to see that this is a phenomenon that is really spread across the country. So I'll briefly talk about what that process looks like. We define the process in 7 different steps. The pre-application is before the health department formally engages with PHAB, but is critical. It is when the health department is involved in assessment activities and making sure that they understand what's in the standards and measures, have done a good job looking at what might be possible documentation of the standards and measures, and we really do encourage health departments to take this step very seriously. Once they have decided that they're ready to apply, the application itself is fairly straightforward. It involves providing general information about the health department, similar to the information that might go in the NACHO or ASCO profile, so the number of employees, the size, the types of services provided, etc. Then after the application has been accepted and the accreditation fee has been paid, health departments send representatives to our office here in Virginia to receive in-person training, and then they're ready to get to the main event, which is documentation and submission. We have approximately 100 measures, and I'll talk more about them in a moment, but health departments must upload into our electronic system, which we call PHAB, evidence of how they demonstrate conformity with all approximately 100 measures. After they have submitted those documents to PHAB, we move on to the site visit. PHAB uses a peer review model, so there's a team usually of 3 individuals who first review all the documentation online and then actually attend an in-person visit where they spend a couple of days talking to health department staff to verify some of the information in the documents, to ask for additional information and clarification. I will say I was just talking to one of my colleagues who is an accreditation specialist here at PHAB. Those are the staff people who attend all of the site visits. And she was saying how impressed she was by a recent site visit, which was to an academic health department. And she noted that there was a faculty member who had a joint appointment with the health department, and that individual participated in many of the discussions during the site visit and was really an important contributor to those discussions. And she also pointed out that some of the interns from the school actually sat in on some of the sessions as well. So it really was notable to my colleagues the involvement of the institution with throughout the whole site visit process. Once the site visit itself is completed, the team of site visitors develops a site visit report, which really goes through each of the measures and describes how the health department has demonstrated conformity with those measures. And then that report goes to our accreditation committee. That is a group whose members, the majority of the members are recent or current health department staff and members, and they make the decision. They have two choices. They can either accredit a health department at that point in time, or they can require that the health department complete an action plan first. So in that, if an action plan is called for, the accreditation committee will specify which specific measures need to be addressed. The health department will first come up with a plan for how they will address those measures. Once the plan is approved, then the health department has a set period of time to carry out the plan that they submitted and resubmit documentation to demonstrate how they've improved on those measures, and then it goes back to the accreditation committee to make a decision. So after a health department is accredited, they are required to submit annual reports to PHAB. Those help us to keep in contact with the health department. It's also where they keep us apprised of the progress they're making on their community health assessment and community health improvement plan and the work they're doing in quality improvement. And then finally, the process begins again. Accreditation is good for 5 years, and after that, there will be a reaccreditation process. One of the backbones of PHAB is these prerequisites. So there are 3 documents that the health department is actually required to provide at the time of their application. And I'm sure you're familiar with these, so I won't dwell on them. But it's the community health assessment, which looks at both the strengths and the priorities and the assets in the community served by the health department. The community health improvement plan, which is the collaborative process of determining which strategies can address those health priorities, as well as the health department's own strategic plan. And in addition to these, we have stuck on the bottom of the slide the quality improvement plan. It's technically not a prerequisite, does not need to be submitted with the application. It is submitted instead with the rest of the documentation, but it's such a backbone of the program that we really do encourage health departments to make sure that they've made progress on their quality improvement plan before they begin the application process. So another word or two about our standards and measures. As I said, there are about 100 of them, 100 measures, and the way they are organized is into 12 domains. The domains reflect the 10 essential public health services with 2 bonuses. One is for management and administration, and the last one is for the health department's relationship with its governing entity. Each of those domains has 1 or more standards, and then each standard has 1 or more measure. And the measure is really where we get into the details and note what are the required documents that need to be a part of each, need to be uploaded to demonstrate conformity. And in that guidance that we provide, it goes through very specifically what are the elements that are necessary, but also provides some of the examples of the types of documentation that could be considered. And so as we go through the discussion today, I'll talk about some of these things, some of the required documentation elements and some of the examples and how they may apply to academic health departments. So I've included in the slide the link to version 1.5 of our standards and measures. That is the version, if you see any references to standards or measures throughout this presentation, it is version 1.5. The measures were originally developed with, as I mentioned earlier, a lot of input from the field. And one of the things that we heard, even after they had been deployed for a short period of time, is that public health has really evolved, and there was interest in adding some new topics or expanding the way these topics were covered. So there were, this slide details some of the more substantive changes in version 1.5. So for all of these situations, we convened groups, we call them think tanks, where we brought together both public health practitioners as well as other experts to talk about what should be included in the standards related to this topic. And so what we would typically do, for example, with public health informatics, is envision where is the public health field going in the next 5 or 10 years, and then incrementally, what are the things we need to put in the standards and measures now so that we can move the field in that direction. So this is just a list for those of you who are familiar with version 1.0. here are a list of the topics that have really been expanded in version 1.5, in addition to some other clarifications and minor edits like that that were made as we made the transition from version 1 to version 1.5. So that is my very quick overview of PHAB. I just want to pause for a minute and make sure there are no burning questions about PHAB or important clarifications that we need before we move on to the meat of the presentation. Okay, well, hearing none, I'm going to talk about, as I said, I'm going to start with some of my ideas about how accreditation can help leverage partnerships between academia and health departments, and then I would love to hear from you about anything that I may have missed or any additional ideas that you want to share. So to me, there are two different ways of thinking about this. One is that there are particular ways in which academic health departments or academic institutions might work with health departments to help the health department demonstrate conformity with a particular standard or measure. And I've pulled out some of those in particular, and we'll go through those in detail. But to me, it seems like these are ways, if there's, for example, a health department that has not yet established a relationship with an academic institution, these might be ideas about, here's an area that we might work on together. And the same thing can happen from the other direction. If the university is looking to engage its local health department, these might be areas where they can offer as possibilities for collaboration. These also, for well-established relationships, these might be areas to think, okay, we're already working together in terms of workforce, but have we thought about what we might be able to do in other areas? So I will go through some of the standards that I've picked out where it seems like collaboration, where there's a lot of potential for collaboration. In addition to the specific standards, I will talk a little bit about ways in which the partnerships could be used for broader issues, so for research and evaluation, for example. So here we are going through, as I said, I've looked at several different categories of standards and measures where I think that there is a lot of potential for accreditation. So within Domain 8, that's our workforce domain, there are two standards. The first one focuses on the development of a sufficient number of qualified public health workers. So this is really talking about developing the pipeline for public health workers. And as you'll see in Measure 8.1.1, there's a really explicit reference to the need for collaborations between health departments and educational programs in order to get individuals interested in pursuing a career in public health. The other standard in Domain 8 looks about ensuring a competent workforce. So it has several different components to it. It includes the workforce development plan and the strategies used to ensure that the workforce has the necessary competencies. It also talks about recruiting individuals, and this is a change. This is an addition from in version 1.5 to look specifically at recruiting individuals who reflect the population served. And then there's also a measure in there about the professional and career development of all staff. So there are lots of different ways in which we might see partnerships play out in Domain 8. There was one example that we read about in one of the annual reports. As I mentioned, the annual reports are documents that accredited health departments provide to PHAB, and they talk about some of the things that they've done after having gone through the accreditation process. And in this particular annual report, they talked about a program that the health department did in conjunction with its university partner to develop a summer program that focused on teenagers living in the urban core. So it was a way to not only recruit individuals who might eventually become students of the university, but also to introduce them to the idea of public health, which might be a career opportunity for them down the line. Another really rich area for collaboration are our standards related to research. So this is our Domain 10. This is in the first standard here. The idea is for the health department to demonstrate how they use evidence to make informed public health practice decisions. I was talking to one of my colleagues who said that when she talked to an individual who worked in an academic health department, this piece here, the ability to identify applicable evidence and translate that into implementing new or revised processes or programs was really the key benefit of the academic health department. So this is a crucial area where health departments actually have to demonstrate what they've done to be able to access evidence and translate it into policy. There's also a measure here, measure 10.1.2. You'll notice on the slide there's a T and an S next to it. That is because this measure only applies to tribal applicants and state applicants. It's not part of the local measures. But this calls for collaboration in research between the health department and university partners. So here, some of the examples might be things like participating in a research agenda setting process, being part of a practice-based research network would count as really working to drive what is, not only how does the health department use the existing evidence base, but how can the health department and its academic partners work together to increase the evidence base. In 10.2, we talk more about being able to understand research results and being able to then communicate them to relevant audiences. So here with measure 10.2.2, the health department needs to demonstrate that it has access to expertise to analyze research. It's very clear that it's not a requirement for the health department to have all of that expertise in-house. Instead, the health department may be able to demonstrate through an MOA or an MOU that they have partners with others who can help them when it comes to analyzing particular research. There's also a measure, and again, this is just a measure that applies to state and tribal health departments, but that is that the state health department provide technical assistance or support to other tribal health departments or local health departments to help them apply relevant research. So not only is the state or the tribal health department supposed to apply it themselves, but they also have to help other members of the public health system in being able to apply research. So I mentioned earlier, two of our prerequisites are the community health assessment and the community health improvement plan. And there's a lot of opportunity in which for health departments to collaborate with academic institutions in developing these two key documents. I want to draw your attention to an article that was published earlier or last year that describes a program that was funded by NACCHO to look at different models for developing the community health assessment and the community health improvement plan. And some of those models involved and really focused on how health departments can work with their academic partners to develop a CHA or a CHIP. And so there are a number of different examples about how students were involved in different aspects of the CHA. So everything from collecting the data to analyzing it to help present it. There are also other examples where instead the academic partner acted as a subject matter expert. So on a particular topic of focus, for example, chronic disease, the academic partner might have helped to facilitate those discussions. In that article, they pointed out a couple of lessons learned. One of the things that several of the partnerships decided is that what was most effective in terms of engaging students was when the student was participating as part of a course related to the community health assessment and the community health improvement plan. They felt that in those cases, the students had a little bit more understanding of the context and were able to participate a little bit more fully, and they also had some accountability because there was a course grade and credit associated with it. One of the other things that was pointed out in this article is that having formal agreements in place, so having an MOU, was helpful in making these collaborations possible. So moving on to just a couple of more areas of the standards where I think there's opportunity for collaboration. We do have, one of our domains is related to access to health care. And in this, there's a standard that really is all about assessing that access. And so this is an opportunity for health departments to work with their academic partners to really understand where there might be gaps in healthcare services and really also looking at which particular types of populations might experience the greatest barriers. So here's a data analysis and collection opportunity that could be done in conjunction between a health department and a university. There are several places in the standards where the applicant is asked to demonstrate how they provide technical assistance to others. And in most cases, these are measures or standards that apply just to the state health department. So for example, in Domain 1, there is a measure which calls for the state health department to provide technical assistance to local health departments and tribal health departments about how to use and develop summaries of community data. There's another measure that talks about providing technical assistance to other public health system partners about the best way to engage the community. And if you look at the guidance language, particularly for the state version of this measure, it states explicitly that either the state health department can provide this technical assistance directly or through an established partner or contractor, such as a consultant or academic institution. So these might be areas where if the health department doesn't have the in-house ability to provide the technical assistance, they might want to work with their academic partners in order to do so. We finally come to my hodgepodge of additional standards and measures, and this list that I provided is not meant to be exclusive. I'm sure there are other opportunities, and in fact, I hope in our discussion today, I'd love to hear from you all about whether there are other standards or measures where you've seen real opportunities for collaboration. But just a couple other ones that I noted is one, there's a measure that looks at the health department and its role in reviewing laws to determine if they need to be revised. And the language in the measure is very specific in that it's looking at an evaluation of the laws for consistency with public health evidence-based and or promising practices. So again, to the extent that the academic partners can work with the health department to understand what is the evidence base related to those laws, that's a very valuable partnership opportunity. Another one is our standard related to the performance management system. So as health departments are establishing a performance management system, working collaboratively to determine what are the most effective metrics or how can the system be designed in order to help the health department have the information it needs to improve might be another opportunity for performance. So I'm leaving up here this others question mark, and I'm hoping that in a couple of minutes you'll have some thoughts to share. But before we get to the discussion, I just want to talk about a couple of other ways in which the health departments and their academic partners can work together that are not related to specific measures. So one thing is, as I mentioned earlier, our standards are both evidence and practice-based. We want to reflect if we learn that there's a particular process that will really help health departments to be better performing agencies, we want to incorporate that in the standards while being mindful that we also have to make sure it's feasible for health departments. And so one of the things that PHAB is beginning to involve in a slightly more formal process is to monitor what is the evidence base related to the standards and measures. And so this is something you'll be hearing more from PHAB about in the future, but we really ask all of you to help us make sure that we're tracking what is the relevant evidence and is the evidence pointing to additional improvements in the standards and measures going forward. We've also developed a research agenda, and I have the link to that research agenda on a couple of pages, but if you're looking for research projects, here are some that we recommend, some questions we would love your help answering. The ones that we've identified as current priorities have to do with understanding not only the barriers to accreditation, but also the facilitators so that we can work with our national partners to make sure that the necessary supports are in place. We also want to understand, are the standards and measures and the review process really capturing what we ought to be capturing, and how can we continue to improve them? We want to know that we have the best ways of measuring the impact of accreditation. We think it's a little early to it is certainly early to fully understand the impact of accreditation, but we want to make sure that we have the metrics in place now so that we can apply them as we have larger numbers of health departments who are accredited. And then we do want to understand what are the early benefits and outcomes for those health departments that go through the process. So to provide just a little bit more context behind those metrics questions and the benefits questions, this is our logic model. And it runs through what we anticipate are some of the proximate outcomes as well as the intermediate and more long-term outcomes associated with accreditation. And so when I say we're trying to understand what are the best metrics, if you look at the proximate outcomes column, we mean what are the best ways of measuring is there enhanced internal and external collaboration. For example, there are a lot of systems that have been developed to really look into a QI culture. So that one, there are some existing metrics, but for some of these, we feel that there aren't the best metrics now. And so PHAB is actually going to be working to try to more closely define what those metrics are, and we would always love partners and others to help us with that. Finally, there are a couple of other ways in which health departments and their academic partners can be involved related to accreditation. So one is we've heard from a couple of health departments that they want to evaluate the accreditation experience that their health department has. So not necessarily the big picture question of what is the aggregate outcome of accreditation, but to really have help in understanding what did we as a particular health department get out of accreditation. And so that might be an opportunity for collaboration. And another, as I said in the beginning, that before a health department even applies, they need to do a really rigorous self-assessment. And there's an example of one university that facilitated that self-assessment process to help the health department to determine whether it was prepared for accreditation. So that is another way in which the academic health department collaboration can really help prepare a health department for going through the process. So those are my thoughts about how the academic health department can be tied to accreditation. But I would love to hear from you either what did I miss, or are there examples of how you've worked together related to accreditation? So with that, I'm going to open the floor for questions and comments.
Thank you very, very much, Jessica, for a really nice review of this subject. And let me just add to Jessica's call, please let us hear your questions or comments, either by voice or by using the chat box on your screens.
And I know we have some accredited health departments, and as I said, other health departments that are in the process. So I'm wondering if you have found, or if you'd be comfortable sharing, how you use your collaboration to help demonstrate some of the standards and measures.
This is Chrissy Rowland from Bowling Green, Kentucky, and I represent an accredited health department. And I'll just share that we submitted a couple of different things. One, we have a memorandum of understanding with our university for internship placements. So we use that and under Domain 10. And then we also, several of us teach at the university, and so we submitted that type of information to demonstrate that. Also, on our community health improvement plan, we have representation from our university, and they were documented in the plan showing their participation.
Great, thank you. And I see that there is a question in the chat box. There's a question from Ann Henry about where are there opportunities to engage community members in the accreditation process. So that is a great question. There are lots of opportunities. The community health assessment and the community health improvement plan are perhaps the most obvious opportunities. The way the PHAB standards are written, it's not even a requirement that the health department lead that process, but what is a requirement is that they engage the community and they are part of a collaborative process. And we are very explicit about the need to describe how others are involved, the need to make sure that they're involved both in the planning process, but then they also have opportunity to provide feedback. So I think that our measures are pretty robust in that area. We also require, as part of every site visit, the site visitors meet with a group of the community partners, because we really want to hear from them. There are some measures in here that talk about you need to participate in coalitions to address health issues. We actually want to hear from your coalition partners and make sure that this is really a meaningful and strong partnership. So I do think that's actually one of the strengths in the accreditation program, is that collaboration with the community is built throughout.
Mm-hmm. We noted before that several others of you were typing, but no messages have appeared in the chat box, so be sure that you've managed to send those questions on to us.
Let's have gone back to the slide with our logical to see if this piques any interest or if there are any responses in terms of thoughts about how we could, as I said, we're really interested in making sure we have the metrics necessary to be able to measure some of these constructs. If there are any thoughts about that or any work that you have done collaboratively to assess these types of items with your health department, we'd love to hear those as well.
Hi, Jessica. We have another question. Michael Kennedy is wondering, can anyone talk about the finances of having a faculty member as part of a department and how to handle this?
So I think that's a great question, but I don't think that I am in a position to speak to that, but hopefully others on the call would be able to jump in.
Well, this is Bill. I can say something about that, although others may have more recent information. One of the ways I was able to manage that when I was still a health department director was to share a position with a university. That is, provide either half the salary from each place, which is, of course, not inexpensive, but it is certainly less expensive than hiring someone directly.
And it looks like Sophie has put her contact information in the chat box. Michael, if you're interested in following up with her about it, she's offered to share what they're doing at Virginia Tech.
Yeah, this is Sophie. I'm at Virginia Tech, but a quarter of my salary is funded by our local health department, and I coordinate our academic health department, so I'm happy to answer any questions about that process.
I will say from PHAB standpoint, we are very flexible in the measures. So there are often a lot of different ways you can demonstrate that partnership. So whether there's an official relationship that has, that has a contract in place, or if there's an MOU, there are often many different ways that you can show that. Or it could be meeting minutes where you show that you've been in the same meeting with your academic partners. So we are very flexible on that standpoint about, regardless of how formal that relationship is.
Are there any other questions for us? It doesn't appear that there's anyone else typing at the moment or anyone else with questions. So one final chance before we wrap things up. Any questions or comments for Jessica or any other members on the call? All right. Jessica, is there anything you want to say about your final slide here in terms of further reading?
These are just some resources that we think might be helpful. There was actually an issue of the Journal of Public Health Management and Practice, which was devoted to the topic of accreditation. So there are a number of different articles there, including a series of case studies that talk about the experiences of 11 health departments as they prepared for accreditation. I also have the links here for the logic model, which I shared, as well as the research agenda. So as I said, if you're looking for research topics, I do encourage you to take a peek at those and see if there are any questions on there that you might want to help tackle. And then we also do have just a list of other references related to accreditation or to quality improvement that we think might be useful. So I really hope that this has helped inspire you to think about ways that you can use your collaborations and leverage them for accreditation, or to use accreditation to leverage those partnerships. And I hope that we'll be hearing more from you and have more and more experiences as we go through hearing about how academic health departments have really helped move the accreditation process along.
Wonderful. Thank you very much, Jessica. Kathleen, any final words from you?
I don't believe so. I would just echo the thanks. We really appreciate having everyone join us here today. And we will be, as we mentioned at the beginning, we'll be pulling the archive and making sure that that is available to everyone who was both on the phone today as well as people who weren't able to join us. So you'll be definitely hearing from us again.
Mm-hmm. All right. And, of course, you will be hearing from us also about the next meeting of the Academic Health Department Learning Community. We obviously don't have a date set yet, but we're hoping that sometime in the spring will be an opportunity for us to get together again over a topic of interest to most, if not everyone. So, one final chance. Anyone have any final questions or comments for anyone who might be on the call? All right. It doesn't look like anyone is typing or asking, so again, let me thank you very much for participating with us today. Especially thanks to Jessica for a very nice and cogent presentation. It was very helpful, Jessica. Thank you. And good afternoon to everyone. Goodbye now.